Heartburn and acid regurgitation are classic symptoms of gastroesophageal acid reflux. With heartburn, affected individuals often experience a burning feeling in chest. And acid regurgitation is feeling of acid backflow into the esophagus, throat, and larynx, particularly when you're lying down. Other less common non-specific symptoms include indigestion, nausea, frequent burping, and bloating. To relieve these symptoms, lifestyle changes and medications are widely used. Avoid heartburn triggers like coffee, tea, greasy, and spicy food. Never go to bed with a full stomach. Don't eat quickly and beyond fullness. Take stomach acid inhibitors, including pantoprazole and weight loss, are the most effective treatments. However, your symptoms may not respond to lifestyle changes and medications. In this video, we want to talk about top 4 conditions that don't let your acid reflux go away. Also keep in mind that you surely need to see a doctor before self-medicating, since serious conditions such as stomach cancer or gallstone can produce same symptoms. So, your doctor may ask for further evaluation like abdominal sonography or endoscopy, especially if you continue to have symptoms despite daily use of acid inhibitors. Now let's start with poor sleep as a common cause of refractory reflux disease. Sleep disturbances and acid reflux are tightly connected. An unpleasant nighttime burning feeling in chest makes it difficult to fall asleep. Besides, acid regurgitation causes backflow of acid into throat and larynx, causing coughing and choking sensation. This results in short arousals during sleep that you may not recall later in morning. That's why individuals with most severe acid reflux symptoms often have worse sleep problems. On the other hand, sleep deprivation of any cause can make anyone hypersensitive to the pain of heartburn. So, even minimal irritations from acidic juices can produce significant symptoms in poor sleepers. Good news is that treating either sleep problems or acid reflux seems to improve both conditions. In short, if you have any sleep disorder, then make an appointment with your doctor to treat it effectively. Sleep apnea, irregular bedtime schedule, and sleep fragmentation due to asthma or an enlarged prostate all can induce sleep deprivation. Next is anxiety and depression. In general, mental health issues, especially anxiety and depression, significantly aggravate acid reflux symptoms. This happens through different ways. First, just same as poor sleep, anxiety and depression turn up pain receptors, reducing the pain threshold and making the affected patients hypersensitive to acid erosion. Second, anxiety is shown to lower the pressure of the sphincter muscle at the lower end of esophagus, escalating acid reflux symptoms. Normally, lower esophageal sphincter stays closed, except during swallowing. This protects esophagus from reflux of stomach acid. With acid reflux, the sphincter muscle is weak and doesn't close properly, thereby allowing stomach acid to move upward into the esophagus. Acidic stomach juices then irritate esophagus, causing symptoms of acid reflux to develop. Third influence of stress on acid reflux is that high stress levels can bring about overeating, drinking more alcohol, smoking, and unhealthy eating, all worsening the disease. So, to make your esophagus less sensitive to erosions from stomach acid, make sure to treat your anxiety and depression as soon as possible. Next is constipation. Many studies have shown that reflux disease and other digestive system motility disorders like constipation commonly go together. For example, a study on over 2,000 Chinese participants showed that constipation is a significant risk factor for reflux disease. In fact, that's because straining at stool due to constipation increases abdominal pressure. Frequent episodes of high abdominal pressure could cause stomach acid to slosh back into the esophagus, which worsens heartburn and regurgitation. Besides, it's important to know that certain acid reducers can induce constipation. Proton pump inhibitors like omeprazole and antacid containing aluminum are the most common ones. So, if treating with these medications induces constipation, make sure to consult your doctor to change the treatment if possible. Similar to constipation, lifestyle habits that increase abdominal pressure, like belt tightness and wearing girdles, are linked to poor controlled acid reflux as well. The last one is smoking. The nicotine in cigarettes reduces lower esophageal sphincter pressure, leading to more severe episodes of acid reflux. Tobacco smoke could diminish secretion of saliva and change its quality as well. Since saliva is critical for protecting esophageal lining, reduced salivation due to smoking could make esophagus more susceptible to erosions from acid reflux. If you know any other habit that doesn't allow acid reflux to go away, share it with us in the comments down below.